Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Calcium channel blockers. Calcium channel blockers. Actually, we have drugs like verapamil and long acting dihydropyridine. We have verapamil, long acting dihydropyridine derivatives like amlodipine. These are used in the treatment of asthma. Calcium channel blockers are useful because these will reduce the heart rate and thereby these calcium channel blockers will reduce the heart rate and thereby they decrease the load on the heart also. So among all the beta blockers which are present, the drug of choice for prinzmetal angina or vasospastic angina is a calcium channel blocker which is verapamil. Beta blockers are contraindicated in prinzmetal angina because they will precipitate the vasospasm. Then this verapamil, if you combine this verapamil with the beta blockers, this will result in complete heart block. So because the verapamil will decrease the heart rate, okay, even beta blockers will decrease the heart rate. So overall, there will be profound bradycardia which might progress to the complete heart block. So as a result, verapamil and beta blockers are never given together. Then the other calcium blockers, if you see the nifedipine is not used as an anti-anginal drug. Why? Because this nifedipine is actually a short-acting drug and it also causes reflex cardiac stimulation. It reflexly stimulates the heart. Obviously, anti-anginal drugs should at least decrease the workload on the heart, but nifedipine itself increases or stimulates the heart. Thus, because of stimulation of the heart by nifedipine, it will precipitate angina and it can also precipitate MI. So, nifedipine is not used in anti-anginal drugs. In anti-angina, is not used in angina or ischemic heart disease.
thank you and thank you for watching.